Hello, and welcome to eMediCore Patients Corner series. Today's discussion is radical inguinal orchiectomy, or orchidectomy. Orchiectomy is a surgical procedure to remove a testicle, or testes. In contrast to a simple orchiectomy where only the testes is removed, radical orchiectomy includes the removal of the testes and the spermatic cords, blood vessels, and nerve bundles that attach to the testes to the body. The spermatic cord is removed to prevent potential cancer cell spread. Inguinal means the incision, the cut, is made over the inguinal area, the groin, and the lower abdomen. This procedure is usually used to remove a testicular cancer or mass. Here we see an incision over the inguinal area between the lower abdomen and the groin. General anesthesia is usually required, and it is usually an outpatient procedure, going home the same day. It usually takes less than an hour. However, if the patient also wants to have a placement of a testicular prosthesis, then it'll take an additional 15 minutes. Here we see an image of 3 different sized testicular prostheses. As with all surgical procedures, radical inguinal orchiectomy has some potential risks and complications. Risks and complications may include, but are not limited to, bleeding, infection, injury to adjacent structures such as nerve and blood vessels, hematoma, a collection of blood, numbness of the skin in adjacent areas, and hernia. Do not take any blood thinning medications, including over-the-counter medications such as aspirin, ibuprofen, or naproxen for at least 1 week prior to the procedure. Normally, when the procedure is performed under general anesthesia, do not eat or drink 8 hours before the procedure. Bring a jock strap, athletic supporter, or snug briefs, and arrange for someone to give you a ride home. Let your doctor know of any and all allergies and medications that you are currently taking, including over-the-counter medications, and if you are or suspect that you are pregnant. Testicular tumors grow quickly, and it is advisable to have the procedure as soon as possible after a mass in the testes is discovered. After the procedure, you will be brought into a recovery room where you will be watched for about 1.5 hours. You will usually be sent home with a prescription for pain medication and stool softeners. You will be wearing a jock strap, scrotal support, athletic supporter, or snug underwear with gauze to put compressing pressure on the scrotum. This is to avoid a hematoma, or bleeding. At home, you should follow your doctor's instructions for when to shower and if you need to apply any ice packs. Wear snug underwear or a scrotal support. Avoid heavy lifting, strenuous exercise, and constipation. Most men can begin working after 1 to 2 weeks. However, it is variable, and you should forewarn your employer that you will be absent for 4 to 6 weeks. Call your doctor if you have fever, temperature greater than 101 degrees Fahrenheit, if you have shaking chills, if there is increased redness or swelling, if you are in severe pain not controlled by pain medications, and if you have discharge.
eMediCore, core medical education. For everyone.
From everywhere.
Forever free.